Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we're going to be talking about translating healthcare reform, which is one of the goals of the Dr. Nancy RN show, is to really help translate healthcare reform for you. And today our topic title is The Affordable Care Act. Will it really make healthcare affordable? And our focus today will be on the cost of healthcare. And I'd like to introduce the fact that we have a very renowned and noted author with us today, Rosemary Gibson. And Rosemary is the author of this book, The Battle Over Healthcare: What Obama's Reform Means for America's Future. And one of the things that I really enjoyed about reading this book is that it is nonpartisan. Her background is healthcare economist, and she is also an editor on the Journal of the American Medical Association, Internal Medicine. And that background really puts her in a position to really go through the facts of the case and really give us a nonpartisan view of really the cost of healthcare. So I want to welcome you, Rosemary, for being with us. It's really it's a pleasure and a joy to really spend any time with Rosemary. And I think that what our viewers would like to know, as far as background, is tell us why you wrote this book to begin with, because it is pithy and very, very good reading.
Well, Nancy, first of all, thank you for having me. It's really great to be here. And thank you so much for having the chance to talk about the battle over health care. I, like many Americans, was listening to this debate back in 2009 and 2010 about this thing called healthcare reform. And I will tell you, I've worked in healthcare for a long time, as you have, and even I was confused about what it all meant and where we would end up. So after the ink was dry, when it was signed into law, I said, I need to write about this. And it wasn't going to be about a Democratic perspective, it wasn't going to be about a Republican perspective, it was going to be about what does it mean for the American people. And one of the pieces of it is, how much is this going to cost? Not just individuals and families, but all of us as a country.
Very good.
Because nobody was talking about that.
Right. And I think that, obviously you were very motivated to really, again, just go through in a very logical way and figure out, what is this all about? And today our show is going to be focused primarily on the cost of health care. And we are going to talk to you about the following areas of interest, which I think you will find will give you some tips. How much will health care insurance cost you? A big issue. Secondly, what are the health insurance subsidies, and what does this mean as far as where are we headed with all the costs? What are the penalties for the lack of insurance? That's another aspect of the finance of care. And then lastly, we're going to talk with you as viewers, what can you do to really try to curb your health care costs and your health care spending, because that's part of this equation as well. So I think that that's a good place to start, and maybe you could tell us in terms of health insurance and what it will cost. What's your thoughts on that?
Well, it's a great place to have a conversation about this, because we've had very little conversation during the whole healthcare reform debate about how much is it actually going to cost. So here we are now, where people are beginning to see how much it's going to cost them, even though the website has its glitches, and that'll be fixed soon. We're getting to see how much it's actually going to cost. There are going to be people who are going to be very happy with how much it's going to cost them. For some, it'll cost nothing. And for others, it could actually cost them more than what they're paying now. Or if they don't have insurance and really aren't too keen on getting insurance, and they do buy it, certainly they'll be paying more. Right. So we can talk about some examples if you like.
Yes, let's do that, because I think that really helps people to really understand, what is different. So if you could give us a couple examples, that would be extremely helpful.
Sure. And again, these are just ballpark estimates. There's subsidy calculators on the internet that came before the website is up and running. So the actual prices will be on the website, but until people can see that, here are some examples of what it could cost.
Okay.
So let's take a family of 4. and they have an income of about $48,000 a year. And they choose a sort of mid-level plan. And for 2014, the estimates are that they'd be paying about $2,800 a year for health insurance. And so that comes out to a little bit more than $200 a month.
Okay.
Now, for some people, that could be a bargain compared to what they're paying now, say if they have a sick child. On the other hand, for some people, it could be more if they have to abide by the mandate, $200 more out of their monthly budget. And they'll have to ask the question, can I really afford this? But also there's out-of-pocket costs, so it's not just the premium, it's the deductibles, it's when you go to the doctor's office. So that's one example. Again,
Right.
That's just a middle of the road what could be.
Mm-hmm.
Some people will love that opportunity, others will say, gee, that's a lot of money.
Okay. So again, every situation is different, and I think that the other part of this is more people will be on that website because with the mandate with employers, yes, they are really still this year having insurance coverage, but people are moving out of that. And tell us a little bit about that and why more people will then be forced to go onto this exchange.
Sure. So there might be some people whose employers have said, you know, Nancy, you've been a great employee, but in our company, because the cost of healthcare keeps going up, we're going to make a change. Instead of having a health plan for all of our employees, we're just going to give everybody a certain amount of money. And we wish you well. Go on the exchange and you'll be able to choose a health plan that's more suited to your needs and perhaps what we're doing.
Which sounds good at first blush, that you could get a more customized version of health insurance that may fit your needs.
Right, but the question is what's the cost and the whole subsidy issue, which we'll talk about in a minute. So the bottom line for the next, couple of months and even perhaps for the next couple of years, people are going to have to be sitting in that middle seat and hang on because there'll be some turbulence. But one thing I want to add is the subsidies vary and how much people have to pay. So I took that family of four earning about $47,000 a year. If we bump that up and have a single person, say in their late 50s, because a lot of people who retire early, not eligible for Medicare.
That's right.
How much will they pay? Well, according to a subsidy calculates from the Kaiser Family Foundation that's very reliable, early on they said it could cost them $800, $900 a month for health insurance. It's more costly for them because of how the subsidies are structured. So for some people, it will be sticker shock. And that's why I think we haven't had an honest conversation about cost, but now we are, and some people will be pleasantly surprised, others will be really deeply concerned and not very happy.
Right. I think that group that you just spoke about, single or even married people that have early retirement,
yes,
unless they really have a lot of money saved up for health issues, this could be a real shift for their budget and planning.
That's exactly right. It will be really a wake-up call, and I don't think people have been expecting that. Mm-hmm. So, as I said, the healthcare reform law went from the Supreme Court, who said it was constitutional, to the Court of Public Opinion, and now it's in the hands of people's wallets, and we'll have to see.
Right. Well, the Court of Public Opinion is part of what you're, doing, listening to this show, so that you can be more informed as a member of that Court of Public Opinion, because that is really what it's coming down to now. Every individual having to really get into the game and figure out where are they going to fit with this whole new landscape.
That's right. And the subsidies, I mentioned subsidies earlier. In the healthcare reform law, because we know how much healthcare premiums are, there's a structure of subsidies. So depending upon your income and your family size, you may get a federal government subsidy. Other people, if their income is above a certain amount, they won't be eligible for a subsidy, and they'll have to pay the full cost. So people will see that. They'll get on and they'll be seeing if they have different incomes over time. Now, one thing that was as a result of remember we had the government shutdown?
Yes.
Well, how quickly that fades from memory, but as part of that agreement, there is now going to be income verification for healthcare reform. Prior to that, there wasn't, which is really quite interesting to a lot of people.
Tell us how that will work.
Well, it's just getting started for how it will actually work, but people's income will have to be verified. The other thing that's interesting is, say if you have very low income, but you have a lot of assets. Maybe it's a big house and a house at the shore. Your assets are not counted for in your eligibility for federal subsidies. So you could have lots of assets, low income, and still get a federal government subsidy. And there are different points of view. Some people think that's okay because they don't want it to be income related. Others say, well, gee, is that really fair?
So that, again, there'll be continued debate, but part of our goal here is less about the debate and more about the reality of choices.
That's right. And I think a reality that we have all seen, hardly anybody's been immune from this, is that healthcare is taking a larger and larger share of our individual and family budgets and the budgets of the state and federal governments. No question about that. And that's going to continue.
Right.
Because there's nothing in the healthcare reform law that stops the underlying cost growth that's pushing insurance premiums up and up and up.
Right.
But how much can subsidies offset that? How far can you go with that?
Right.
There's a limit to it.
Right. Well, you've made the point in your book that the insurance debate and the insurance costs are really wallpaper over the underlying issue, and that is how much cost is associated with care in this country, which is considerably more than anywhere else.
I'll tell you what really worries me and keeps me up at night is I have this image in my mind, and I'm sure many of your viewers will remember this. It was when we had the Gulf oil spill.
What year was that approximately? Do you remember?
You're testing my memory. But there was this image of oil coming out of the crust of the earth, and there was no way to stop it, just coming out. And weeks and weeks and weeks, and wildlife were being hurt. And finally, thank heavens, the engineers found a way to cap this immense amount of oil coming out. In healthcare, we have this tsunami of spending on healthcare, and we don't have a way to stop it. And so that's why how much people are going to have to pay. And I go into some of the reasons why that is in Battle Over Healthcare. I look at how the deals were made to get healthcare reform politically accepted. And I think we gave away a lot. We gave away a lot to the industry, to the drug companies, to the hospital industry, even to the insurance companies. We gave a lot away in return for no cost control. And that is really worrisome. There were some provisions in there to try to control costs, but as of now, they're minor and they're not stopping the overall trajectory.
Right. So I think that this is really the most sobering part of this whole debate with healthcare reform. Right now we're focused on the website, getting that up and running, and the insurance decision making that people are really confronting right now. But as I said, the part of this discussion, which we really have to get into and take a much deeper dive, is why does it cost so much, and how can we curb some of those costs, because no insurance package is going to keep accelerating to the pace of the cost. In the industry, you'll often hear the term bending the cost curve. It's very difficult to do because the system is set up for all the escalation of costs, not set up to really bend the cost curve. But before we get into the real nuts and bolts of that, you mentioned in your book that some deals that were made long ago really set the stage for why costs have escalated so much. And I think that would be very interesting to share with our viewers.
Oh yeah, this is not new. You're exactly right, Nancy. Recently, I was reading about the history of the Medicare program and how it was actually enacted.
Then now we're going back to the mid-60s on this.
Right, 1965, Lyndon Johnson was president, and he wanted to make sure that older Americans had access to health care and a way of paying for it. And so there were bills in Congress for this program called Medicare. And at that time, the Secretary of Health, Education, and Welfare, which is now current day Health and Human Services, was Wilbur Cohen. And there was a wonderful interview with Wilbur Cohen, and he's, this was years ago, and he described in this interview how he had to promise members of Congress, members of the House Ways and Means Committee, that there would be no control by the federal government over hospitals and doctors, how much they would charge, how often they would charge, in order to get Medicare passed. So the federal government basically gave up control to the healthcare industry.
Wouldn't that be considered, though, a free market system that the government, I mean, this is where there would be different political views on this. The government shouldn't get involved with any kind of cost controls, because then you're really violating the free market system. I'm sure that was part of the debate, even though I wasn't part of that discussion.
Sure. I think there's two ways to think about that. So there are two ways to control costs. One is through competition, price competition, and the other is through government regulation. The problem when we started out with Medicare is that there was nothing. There was no mechanism to put in place to have costs moderated. And so what happened is we gave the keys away to the federal treasury, from the keys to the federal treasury to healthcare. And so we're seeing the consequences of that. And frankly, in Battle Over Healthcare, I say we really did the same thing with the healthcare reform law. There were some efforts to try to tame it, but they got in there, but you knew that the healthcare industry had the power and the muscle to quash them and to never let them, see the light of day.
Well, then, whether it's a political debate or not, we are now under staggering cost issues in healthcare.
Right.
That's one of the reasons the employers are moving away from insurance, because it's really the underlying cost of healthcare that they're very worried about. And I think that for the average citizen, now that you are going to be seeing this with more transparency, you will be seeing a much clearer picture of the cost of healthcare. Now, a lot of people don't even read their medical bills. I happen to read mine and my family's, and that's when you start to see how much it costs for a length of stay in a hospital, for what the procedures cost. It is amazing. But again, most people don't worry about it. They may say, "Oh, it's really high," but thank goodness I have insurance to cover it, and that's like the end of the story.
I'll tell you a quick story I just heard last week. I was giving a talk to a group of members of the public who, as part of a course, that are very interested in the politics and policy of healthcare, what it means for them. And a woman raised her hand and she said, "I have to tell you about one of my relatives who lives in a rural community down south. He went into the hospital for one night and came out and he was fine, and he got the bill and he looked through it, and he was very shocked to see that he had been billed for 2 nights.
Oh, interesting.
And so he called the hospital billing office and said, "I wanted to tell you about this little problem with this bill." And the first response of the billing representative was, "Oh, you actually read the bill."
Right.
So I bet that there are people who are betting the farm that the bills have become so complex that people give up and don't even read them.
Right. Well, I can say that's not the only industry that has tough bills done. I won't go into the other industries. I can't understand those bills either. But still, since our topic is healthcare,
Sure.
What do you think people can do about this escalating cost? Because this is really feels like it's bigger than anything that anybody can impact. And that's really what we're trying to get down to.
That's
what
right.
actions can people take?
I think there are 2 things people can do. Let's look at the 2 cost drivers for how much people pay. It's the price of things and the volume of things. Volume, I mean, how often do you get tests and surgeries and take medications? And I'll give you one little data point. There are 90 million visits to physicians every year by adults for sore throats. 90% of them, there's nothing wrong. People go to the doctor for colds, the plain old cold, and they expect antibiotics for colds. So let's talk about the simple things that people can do. If you need health care, absolutely get it. But one of the problems we have in this country is that there's overuse. People are getting things that they never should get that are not medically appropriate and really won't help them. In some cases may harm them.
Right. So
get the care you need, not the care you don't. Do you really need to go to that doctor? If you do, yes. But if you're doing it just because, you might want to think twice about whether you really need it.
Right. So some of the overuse of these services could be driven by your group of caregivers to some degree, but some of it is self-regulating,
Yes.
which means that you can make the decision about whether you need it or not, because these examples are just basic. If you stayed home and took 2 aspirin and gargled and stayed home from work and took care of yourself, you'd probably be in a much better situation, and you wouldn't have to go to the doctor, sit in the waiting room with other sick people, find out that there's not much they can do anyway. And I think that your point about people demanding antibiotics for things that really have no impact on the illness and also have bad consequences, because it really does put you in a situation where you have less immunity going forward.
The next time you get an antibiotic,
it may
not
work.
help you.
Right.
Then again, there's also physicians that are prescribing antibiotics inappropriately, even when patients don't ask for them. We're publishing a narrative in JAMA Internal Medicine on this. Actually, a physician who was going to a conference on antibiotic resistance and appropriate infection control, and he went to a doctor because he had a sore throat and he needed to go, given his other conditions. And he was fine. The lab test said he had no strep throat, but he actually got a prescription. He says, well, I don't need this. So it's both sides. It's both patients and providers that have to work on the volume issue. And of course, your advice about look at your bill.
Right. Look at your bill.
And question your bill. I talked to a gentleman last week, also in this course, and he said, we got 20% off that bill, my mother's bill in the hospital, because it was just impossible, the things that were on there. That she just didn't have them done.
Right. Right. So you have to really scrutinize, and you have to really think through each of your situations. How do you think people are going to respond? I mean, with bigger co-pays, do you think that will be a way of getting people to stop and say, do I really want to have the co-pay kick in? Do I really need to have this test? Do I really need to have this visit? Do you think that will be an incentive?
The research shows that co-pays really do affect people's decisions. And the challenge is we want co-pays because people should have some skin in the game for things that are not emergency situations. But will people have the knowledge to know when something warrants going to a clinic, going to a physician, and when it really doesn't?
That for some people is very hard to really make that differentiation. So the question is, how much burden can you put on the average citizen to do their own self-diagnosis?
Well, that's right, and that's why it's so important if you can find a good physician or a good nurse practitioner that can go through the decision process with you. Is this really necessary?
Right.
Do I really need this? What difference will it make? What happens if I don't have it?
Right.
To really come into a joint decision, and you put out front, these are some financial constraints I have. Is there a better way we could achieve the same end, but have a less costly outcome?
Right. I think that set of tips that Rosemary just gave us is a theme that we've brought up in other shows. We want you to have the confidence to have that kind of conversation.
That's right.
It's your time, it's your life, it's your money. And so a lot of times people feel like, I better not second guess my treatment team, or this is a good person, I've really trusted them, therefore I shouldn't question. You're saying that people have to question.
Absolutely. I'll tell you another story. I was giving a talk to a group of state legislators, actually in Atlantic City a couple of years ago. And I was talking about overuse, commonly overused tests like X-rays and CT scans, as well as the most commonly overused surgeries, like back surgery and heart bypass and cardiac stents. They're just overused. People are getting them when they shouldn't be getting them, and some people, in some cases, are harmed by it. Anyway, so after the talk, a gentleman comes up, and he was actually the speaker of his state assembly. And he said, I go to my doctor every 3 months, and I get a chest X-ray every time. And I said, do you have any underlying medical condition? I thought maybe it was a lung cancer patient or something. He said, no. And I said, well, what do you think about that? And he said, well, after listening to this talk, maybe I need to talk to my doctor about not getting them so often. I said, that would be a really good thing. So here's an educated person, informed about lots of things, and he was getting a chest X-ray every 3 months. And chest X-rays, they're good if you need them, but they do have, some radiation. X-rays were actually labeled a carcinogen by the NIH, a number of years ago. They're a great diagnostic tool, but not every 3 months if you don't need them.
Right.
So we have to begin to wake people up and begin to ask, well, why am I getting this? Same with dental. So a deputy speaker of another state's legislature came up and said, what about dental X-rays? That's a great question. Do you need them every 6 months?
Right. Well, there are protocols for these things, but I think the point that you're making is that not everybody even knows what question to ask. And the question is, what do you ask about and what don't you ask about? You can't ask about everything.
Right.
There's not enough time in any office visit to hardly focus on what you're there to begin with, let alone be raising all these questions.
Yeah, doctors and nurses are really compressed for time. So we don't have a chance to talk about these things. So it's cheaper to actually or more time beneficial to just keep doing, even though it's not necessary.
Right. But I think that this is part of what we're going to see change. It may take time. It's not going to be an overnight change. But people asking for those validations of what they're getting.
Absolutely.
Like we do in anything else we purchase.
I wrote a book just on this topic called The Treatment Trap. We can have a whole conversation
about that. Have you come back and do that? I read that. That's very interesting as well.
It's about the common overused procedures and tests and what we need to do to get the care we need, not the care we don't.
Right. Well, I think the point that we're making in this show is that everyone's focused immediately on insurance, all the changes and the actions that you have to take, the decisions that you're really trying to make in terms of your own insurance, whether your employer is going to stay in the insurance game or not, what your family is going to need, projecting what those needs may be, and then trying to match that to the best insurance package that you can find on the exchange, figuring out if you are really eligible for subsidies. As we've heard from Rosemary, some people may be eligible for subsidies that they didn't even think they would be. You're going to check all that out by going to the website, which, even though it was very tough to get out of the gate, that is a mechanical issue that can be fixed. So that will be functioning. I think we can depend on that part of it as far as getting the information. Getting the information is only the first step. Then it's the decision making that people have to really analyze and make a decision and figure out, okay, what am I going to do next? But the point of this conversation is that the cost of health care is escalating. It is not coming down. You are paying the price for that one way or the other. And the bigger dialogue that is really ahead of us, I think, on a national scale will be the cost. And I think it is becoming more transparent little by little, because I heard on one news program that because everybody's like trying to get all these sound bites in, some reporter took the opportunity to call a number of hospitals and find out how much it would be in that marketplace to have a baby, and got such a wide range of costs for a healthy mother and in terms of a delivery. One has to step back and just listen to that and say, it is the same baby.
That's right. That's right.
It's going to be the same baby one way or the other.
And also, it's not just price, it's quality of care.
Right.
People want to know, is this really the best place for me to have it? And that kind of information we don't have yet as the public. So we're getting more price, but not quality.
Right. And so I think that what we are doing is we're really sort of opening this debate for you, not in terms of a political debate. This is really a conversation and debate about what's going to work for you. And that's really the purpose of this discussion. So I just want to say that what we've covered today is some basic understanding of what health insurance is going to cost, what are the subsidies, what are the mandates that employers are dealing with, and what are you going to do about this in terms of the escalating cost, and just even being aware of the costs and having some appreciation for where this is going. It's going up, not down, and how you can maybe take some very small but important steps.
That's right.
I mean, if 90,000 people, as you said, are going to a doctor just to find out about a sore throat, that isn't going to make any difference. Yes, if it's sustained and you have had a history of that and you know that this is really something that you need to check out. But if it's just sort of the common sore throat and half of the people didn't bother going, they stayed home, as I said earlier, that you take care of yourself, you eat better, you gargle, whatever you want to do to make it feel better, and then you don't, waste that office visit, you don't pay the copay. Those little steps add
Absolutely.
up. And that really can help us. And there are many, many opportunities where we can take a look at that and do it better.
Absolutely, and we need to do it.
Well, I want to thank Roseberry for being our guest today on Dr. Nancy RN, because someone with her background, a healthcare economist, a person that really decided to write this book because she, like us, like none of the rest of us, at least anyone I know, who said, gee, what's this all about? She decides, I'm going to write a book because I'm really going to take that deep dive and I'm going to do all the research in back of it to sort of figure out what is really going on here. But her due diligence has really helped us to understand this process so much better. And I really want to thank her for spending time with us today. And I hope that you've learned something from this show. So thank you very much for being with us. If you'd like to catch this show again or other shows that are related to this, just catch it on the website, drnancyrn.com. Thank you very much and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.